Hello again, our dear viewers, and with our first distinguished guest for today. Neurological symptoms are often misunderstood and surrounded by myths. Today, we address common fears and medical misconceptions from headaches and MRI scans to mobile phone use and explain when symptoms are harmless and when they need medical attention. For that, please welcome with me Dr. Ibrahim Alharbi, Neurology Registrar. Welcome to the show.
Thank you so much. I'm honored to be here on the show. Thank you for having me.
Of course, our pleasure. So at the beginning, many people will have like some misconceptions about neurology symptoms. So could you address that for the viewers?
Okay, so the most issue we're having here is people who have headaches. They frequently associated with brain tumors, and I have good news that brain tumors are extremely rare. Few cases per 100,000 per year. Headaches, every person in their lifetime has been experiencing headaches. So it's a very frequent, one of the most common symptoms actually is headache.
Exactly.
So, you know, it's rare, but we will talk soon more about how do we distinguish.
Because sometimes like some people could have like a huge day, you know, like a lot of work in the morning, like teachers,
stress is one of the
like
most
different jobs, they have like a lot of interaction with people, and they go home, they have some headache.
100%.
That could maybe result of like the interaction they had earlier. They take a nap, but they become better. But when can we distinguish between a normal headache and the one that we need to see a physician?
All right, so headache, the most common type of headaches are migraine, tension-like headaches, sleep deprivation, or stress-related headaches. How do we distinguish it? You know, one of the videos I posted online reached about more than 8 million views regarding how do you know if a patient has a headache related to brain tumor or not. So it's a very hot topic, you know.
Exactly, it is, yeah.
So if a headache has what we call it as a neurologist, red flags. When should you actually address this headache and go to the emergency department or get it checked?
Which means you have a serious problem.
Yes. The red flags, the name we call it is Snoop 4. So you can review it online. It's Snoop 4. So if you have any of these symptoms, then you have to go and get it checked. Systemic features like headaches, fever, chills, confusion. Then alongside with the headache, then you have to go and get it checked. Or if you have a neurological symptom like weakness in your upper or lower limbs, speech problems, visual loss, or visual symptoms, you got to get it checked. If you're older than 50-year-old and you have a headache, you have to get it checked. Let's say the headache is the worst type of headache of your life and it reached its peak within minutes, then you have to think that it's serious. If you had head trauma, then you had a headache, you have to get it checked.
And that's really interesting because some people, regarding like the trauma or like maybe the tumor, they associate headache with brain tumor.
Yes.
In your opinion, why does that happen?
You know, as human beings, brain tumors is frightening, you know. Just talking about it is frightening. And we always assume the worst case scenario. Survival instinct, you know.
Yes.
So for headaches, usually related to brain tumor headaches, they come with other symptoms other than the red flags I've mentioned. They can come with personality changes depending on where is the location. For example, the frontal lobe, if the tumor was there, you'll see changes regarding to the function of that lobe. Or a seizure, you know, some seizure attack. With the headache, we will think maybe, okay, what is going on? We need to do an imaging and etc.
That's really interesting. And does that like also cause like some behavioral change as well, or no?
Yes, of course. Depending on where is the lesion itself
located,
personality can be changed, specifically in the frontal lobe. So alongside with the headache, you might be having other symptoms that you'll see that this is a brain tumor or not.
A brain tumor. And regarding like to check and diagnose the case itself, what are some of devices or maybe like some of the procedure that you use to
the most important, we call it hands-on device is
hands-on device.
For us neurology is the brain MRI. MRI brain.
Like the scan.
Yeah. Although neurologists are extremely well trained to exactly localize where is the lesion. This is the whole point of neurology. is to, without any scan, you come to me and I can localize exactly where's your lesion, if you have one.
If you have the scan.
Yes, without the scan.
Without the scan, you
Without
can
the
do it.
scan, a
MashaAllah.
neurology doctor
With
can
experience.
localize with experience and knowledge. This is
That's
why I
amazing.
love neurology, you know?
Yeah.
This is why I
can
am
see there are
into-
some hidden magic in it.
Yes, 100%. If you know one of those detective shows, it's like being a detective, honestly.
Okay.
And it's an interesting specialty.
That's really lovely. I love like how you use that concept
Yeah,
to relate
yeah.
to. That's really amazing. And the MRI, even though like it's very effective, some patients they could have like they maybe are hesitant to go to it and they have some fear towards it. So how can you calm them down and help them to take that step?
Some patients are actually claustrophobic,
Mhm.
okay? Or some patients, they think it's harmful actually. But I gotta tell them that MRI is considered very safe because it's not using any ionizing radiation. It's not like a CT scan. It's using magnetic fields and radio waves.
Mhm.
So you're not being exposed to any kind of radiation that's scaring you or something.
Like
So
something
it's-
normal.
Exactly. When do we have to consider or worry if the patient has a metal implant, for example? You know, patients with dental implants or cardiac implants, then we have to take into consideration
'Cause that
doing the
might
MRI. It can,
affect-
yeah, exactly. You know, when the MRI machine can pull the metal, so we have
Exactly.
to. The other consideration is if the patient has renal failure or kidney disease. If we're using a contrast, then we have to weigh the risks over the benefits because it might affect the kidney function.
Like on the longer term.
Yes, but otherwise,
Mhm.
it's very safe.
It's very safe. And that's
Mhm.
really good for those who are watching us right now and they are afraid about taking the step for MRI. Then be assured science is developing.
Mhm.
And today we have like the recent developed tools that we have and you are in a very safe hands. There's
100.
nothing to be worried about. And regarding like MRI, does really frequent like exposure to MRI and also like the scan imaging testing, could that affect the brain or like affecting the health of the patient itself on the longer term?
As I said, MRI will not, mostly will not affect the patient's life in a negative way.
Even if
Even if it's a frequent. But if
Okay.
it's frequent, we got to question ourselves. Is it really necessary to do frequent MRIs? Because you know how when MRI is done, it actually takes a long time. Half an hour to up to 2 hours. It depends. And we have other patients waiting in line that they might be more important to do the MRI scans. So for us and our protocol is the right scan for the right patient at the right time. This is our policy. If we're doing it frequently, are we wasting money? Are we wasting time? We need to think about that. So we dislike this frequent imaging in general. Yeah.
That's really good. So now you can double sure
Yeah.
it's going to be all right and it's going to be really safe. Alongside of MRI scans and also like the medical treatments that we give people, there are also like the herbal side of it, which people sometimes they use to relax themselves down
Mhm.
and they can help in like making someone relief from the headache. So what's your perspective on that point?
Okay, so you know, as a medical professional doctor, you know,
Talking about science now.
talking about science,
Yes.
we are allowed to treat
Mhm.
based on evidence-based.
Yes.
Okay, so even if anything is FDA approved with the WHO, we always have to make sure this is evidence-based. Whatever drug comes into the line, it's going to be tested. Trial 1, trial 2, trial 3, 4.
On
Make
different
sure it's
patients
safe
as
to
well.
Patients, before that, animals, and then side effect. And then, so it's a whole process. Have we done that for
The herbal
for the
or
herbal,
alternative.
I'm not disagreeing
yeah.
with that. Honestly, because some medications we use the herbal
To treat them.
to
Exactly.
treat them.
Yeah.
So I'm not against that. I'm just with the evidence-based because I want the best for the patients and I don't want to harm them in terms of side effects. For example, some herbal medications, they might interact with the blood thinner medication, the stroke prevention that we give, or anti-seizure medications.
Mhm.
They might affect that. So we need to pay attention to that. some herbal medication, they have some side effects like allergic reactions,
Okay.
other than the interaction with the drug that we use. So, you know, some ashwagandha
Yeah, some
treatment,
combination.
so
get-
other treatments been going on, but we need to actually have
And they
some
like
evidence.
spread like a wildfire.
Yes.
Everyone like talking about it, you know, using it without any real knowledge or
With
like
the
evidence.
power of social media,
And the
anything
power of
can spread.
words, mouth.
And the mouth, anything can
Anything.
spread.
And that's why you also like in social media try to raise awareness
100%.
for people and let them know like about the different types and the medications.
I like to tell everybody that's not even in the hospital and tell them and teach them about medications,
Some general
diseases, general tips, headaches, everything, so that they don't have to come to the hospital. We wish them wellness and health, basically.
That's really awesome and also like very humane to do. And regarding like, sharing your wisdom, awareness, and also like talking about different things, some people, they are still hard-hidden. Even like when it comes to some patients, you explain to them everything and they still insist on something they believed on. So how do you deal with such cases?
So these cases usually are the older generation. For us, we have to go step by step. We have to explain to them sometimes the science, sometimes the side effects of whatever that's going on in their head if they're taking this medication. And we have to always let them know that we are on their side. We are never against a patient. We're always trying our best for the patient's safety and minimize the side effects.
The side effects.
We're not harming you. We don't want to harm you.
Exactly. You are with their side.
Yes.
You are trying to show them like all the possibilities and let them know like they're all gonna be safe for them.
Yes.
That's really very amazing work. And regarding like distinguishing between neurology symptoms and also like the regular one that we face on daily basis, what are the lines or like also the red flags for that?
For which one exactly? Which?
For like the brain tumor.
The brain tumor. Okay.
Yes.
So, how do we differentiate if something is worrisome? I teach the 3S rule.
The 3S rules.
Yes.
Okay.
Suddenly, all of a sudden, this happened to you. The first S is sudden.
Like
Second one.
everything was normal, and
Yeah,
all of a sudden it happened.
Sudden. Then you have it.
Okay.
You have to. Wow. Okay. What's happening? I need to get it checked. The second S, severe. It's bad. It's getting
Extreme.
worse.
Okay.
It's
Increasing
painful.
within time.
I can't tolerate that. You have to get it checked. The third one is something new for you. You know, you are your own doctor. You know that. If something is strange happening to you, you know yourself, you know you're normal. If this is your normal headache, you know that this is your normal headache. But if it's getting worse, if it's all of a sudden something strange to you, then you know yourself better than anyone. So I just tell everybody the 3S
The
rule.
3S. Sudden,
and you'll know whatever.
severe, and the last one?
Something new for you.
Something new for you.
It's neurology, non-neurology, you can use it to whatever.
Okay, that's really good. So our dear viewers, the 3S, sudden, severe, and something new. As soon as you have them, then make sure there's something wrong and you need to see a physician. And as you know, like social media, there's a lot of things that people spread without any knowledge.
Yeah.
And I know it's giving like troubles, giving to other people who in like the field they studied and they done like all the things, like a lot of headache.
Yes.
So how like you can make sure like people are getting, I know you cannot reach all people, but in this case, what one things you try to do often more?
I try to correct those videos, because you know the power of the social media, it's a double-edged sword. You can teach, you can learn things, not just medical, everything I can learn, and it's very interesting. I am happy about that. But what I'm not happy about is someone who's not even a medical professional person throwing whatever knowledge they have in their pockets and creating things and people. If something is new and if they see it's strange, they will easily share and comment, and that post can go very viral.
Very viral.
One of the posts, it was very interesting, disappointing as well. One of the posts was, picking your nose is related to Alzheimer's disease. And I was just there, and I'm a neurologist, and I'm like, what is going on? There is no proven science yet. Not at all. It has been only done on rats. So
But not
only
on
rats, not even a human.
And that's really something powerful to conclude the show with, which is like, make sure that you don't take your information from any source, like Wikipedia, but a
Exactly.
human. Take your sources from people who are knowledgeable, who done the study, done the evidence, and they know about what they are talking about, and they have certificates. So that you make sure that you are spreading only positive and correct information. Thank you so much, Dr. Ibrahim Alharbi, for sharing your insight and perspective about neurology and how we can make sure to have a safe life. Thank you.
You're welcome. Very glad to be here.
It's our pleasure. And now, dear viewers, we're going to take a quick break, and then we're going to be back. Stay tuned.